Dengue fever is a vector-borne disease carried by the Aedes aegypti mosquito. It is caused by the flavivirus and occurs in either a mild or severe form in tropical and subtropical areas of the world. Globally, 50 to 100 million cases of dengue are seen yearly.
Dengue is endemic to Jamaica, meaning that since its introduction in 1977, we have cases that occur every year. The cases of dengue fever, including severe dengue, can occur at any time throughout the year. An outbreak is declared when the number of cases increase above the usual that is expected for that time of the year.
Dengue is transmitted to humans by the bite of the infected female mosquito. Symptoms typically begin 3 to 14 days after someone gets infected with the virus. Symptoms can last from 2 to 7 days.
The incubation period is usually 4 to 10 days, and illness begins abruptly, and there are essentially 3 phases of the illness. First phase is where you have the fever. The second phase that you can go into is a critical phase, and then you have a recovery phase.
Over 70% of persons who contract the disease usually experience mild symptoms. Persons affected by the mild form of the disease may experience fever of 40 degrees Celsius or higher, headache, muscle pain, and bone and joint pain. Some people may also experience nausea, pain behind the eyes, swollen glands, vomiting, sore throat, rash, and diarrhea.
So you can see that it's a range of symptoms that can present, and therefore, when you initially present with dengue, it may be seen as different illnesses. It may be seen as gastroenteritis, it may be seen as an upper respiratory tract infection, or it can be seen as dengue fever.
To be on the safe side and put speculations aside, persons who start experiencing symptoms are advised to visit their health facility or doctor for medical advice and treatment. If indeed you have dengue, do not self-medicate with treatments that can worsen your illness or cause bleeding. So be sure to have a discussion about dengue with your doctor. The health ministry says doctors who recognize the presence of a fever should also have a high suspicion for dengue and treat with the necessary precautions. For mild cases of dengue, persons may treat themselves at home with specific types of over-the-counter medications, but heed the warning.
Fever and pain to the joints, pain to the muscles, must be treated with only medications that have cetamol, paracetamol, and Panadol. You can also use tepid sponging, fan therapy, and increased fluid to assist with decreasing the fever. Do not use medications that contain aspirin and other non-steroidal anti-inflammatory drugs such as ibuprofen and diclofenac. You must read your labels carefully. If you are unsure, consult your pharmacist or your doctor before using the medication.
The drugs you should not take while experiencing dengue have been known to cause and/or worsen bleeding and increase the severity of the disease. Besides the mild form of dengue, persons can also experience a more severe form called dengue hemorrhagic fever, which is a rare complication of the illness that can lead to death. Usually the fever that comes with dengue lasts for about 5 days, and it is usually when the fever is going away that persons tend to worsen. Warning signs include persons not eating, experiencing persistent vomiting, lethargy, restlessness, shortness of breath, pain in the abdomen, or tenderness in the abdomen. Persons should also look out for signs of bleeding.
Those signs of bleeding can include bleeding from the gums, bleeding in the urine, it can be bleeding in the stool. Usually though, when you start getting bleeding in the stool, in the urine and stuff, you have reached a severe point.
It is important to note that a case of severe dengue can occur without symptoms of bleeding. Also, in a case of severe dengue, there may be difficulty in maintaining hemodynamics, in which a person's blood pressure tends to drop suddenly and circulation to vital organs is affected.
With dengue, fluid tends to seep from the blood vessels to the outside of the vessels, meaning that there is decreased blood flow to vital organs. And that is why you get the symptoms of lethargy and restlessness and pain in the abdomen. What those signs are signs of decreased perfusion to the brain. It means that enough fluid is not going to the brain because persons are dehydrated. Okay, the dehydration and the signs of dehydration are very important to treat.
Persons are warned to not wait for these signs and instead go to the doctor or hospital early. People with chronic illnesses such as sickle cell are at a greater risk of experiencing severe dengue. These individuals must use precaution when taking their medications.
If you have a chronic illness that you may be taking medications for and you think that there may be some interference with dengue, you must speak to your doctor to decide whether or not you should continue to take these medications.
In order to effectively combat and limit the spread of dengue and other mosquito-transmitted illnesses, persons must eliminate mosquito breeding sites in their surroundings. Breeding sites include old tires, laundry tanks, dish drainers, covered tanks or cisterns, drums and barrels, discarded buckets and containers. Other sources are pet dishes, construction blocks, bottles, discarded tin cans, tree holes and bamboo, bottle pieces on top of walls, old shoes and flower pots. Mosquitoes can also breed in discarded toys, roof guttering, bromeliad plants, garden containers and tools, brick holes and unmaintained wading or swimming pools. Where water is stored for use, the containers must be properly covered and sealed against mosquito entry. The use of mosquito repellents containing DEET and long-sleeved clothing are also recommended for personal protection. For more information, please contact the Ministry of Health, 10 to 16 Grenada Way, Kingston 5. Call them at 876-633-8172, 876-633-7771. Information is on the web at moh.gov.jm and contact can be made by email, pr@moh.gov.jm or on social media.